Hello, everyone, and welcome to this audio podcast. This podcast is part of a Proxi beat. This audio podcast is part of the Catharsis Scrutiny. This audio podcast as part of the Bostics Interpol. This audio podcast as part of a Storm of Bostics production. In this audio podcast, as part of this sort of this sort of snapshot sort of series, if you like. There will be an overview in this audio podcast on looking at immunobiology and scientists and scientists in context in context of community. And so uh, in this as part of this audio podcast, this sort of the sort of a publication in around this work can be identified through the the Biomedical Scientist in a publication in a publication in a publication of the Biomedical Scientist from June 2000 June 2016. Uh, so um, so in this overview, so scientists working in the National Health Service or in the private sectors are familiar with and those who are familiar with test results and investigation and around analysis and interpretation generally. And at the same time, not all laboratory data are of direct relevance when reporting, but a general knowledge of these is recommended in order to understand in order to understand a patient's sort of investigation, a patient's investigation and investigational history. And so increasingly, scientists are able to sort of validate and interpret point of care tests POCT results, or at least know how investigations and tests are important in line to in line to in line to sort of clinical and medical sort of diagnoses. Uh, such knowledge at the same time should also allow or at least prompt scientists the opportunity to complement service providers and service users with an educational basis and understanding of sort of the main analyses and main analyses, examples being sort of the immunological basis of cross matching serology, and align to sort of align to also transplantation. And therefore scientists in such specialties should seek also opportunity to provide education and interpret results and provide provide a knowledge sort of knowledge underpinnings. So this article, as part of this the article or the published works, and as part of this audio podcast, as will will and have sought to provide an overall perspective of a particular long-standing condition in context of public health, being chronic kidney disease, and the potential role of scientists in community. So, with the expanding utilization of digital and technological media by public health public health service providers and and in, and in in around sort of service users, there is a need or requirement to evaluate this sort of a scientist role, scientist sort of a scientist's role. So research has explored the effect of availability of internet-based health information for patients in around health education and health education or healthcare education, and studies have also found that a significant proportion of people, of the public, rely on the internet, tend to rely on the internet to make critical health decisions, and often bring information retrieved from the internet into healthcare consultations. For example, scientists at the same time are able to provide uh, tests a test interpretation qualitatively, quantitatively, or semi-quantitatively. Hematology and immunological results, for example, are generally expressed quantitatively, i.e., as a set of numbers, and microbiological and immunological results, for example, tend to be semi-quantitative in that reports will identify them in so much that reports will identify um, will identify sort of microorganisms, for example, present, and describe the sensitivities to antibiotics, and provide assay results relating to transplant compatibility. Retrospectively, in the clinical setting, at the same time, and through traditional groups, recipients and patients have helped one another adjust to experiences of living with sort of chronic illnesses by exchanging informational, emotional, and instrumental forms of support. Informational support, for example, exchange of advice, explanations, research, opinions, and experiences, help patients and carers understand and learn to cope with disease or diseases. So scientists need to be able to share scientific knowledge in terms that laymen can understand to help bridge gaps in public understanding relating to clinical scenarios, especially to capture patient-reported outcome measures, patient-reported outcomes, including symptomology, status, physical function, and well-being. So. Now, this audio podcast will delve into a little bit of renal nephrology, transplant immunobiology more specifically. So only a kidney donated to a recipient by an identical a twin will be the same genetically. In all other cases, the organ will be recognized by the immune system of the recipient as foreign, and an immune response will attempt to amount to a rejection. The risk of this is reduced by ensuring that the genetic makeup of the donor and recipient is closely matched for example, laboratory investigations such as or markers in laboratory medicine, such as the human leukocyte antigen HLA, matching, and suppression of the recipient's immune system with drugs for as long as the grafted transplant is for as long as the grafted transplant function is important. So in humans, and in anti-human general sort of clinical sciences, the major histocompatibility complex, or the MHC, is the HLA, human leukocyte antigen locus, and antigens vary between individuals, making perfect matching extremely challenging. So unfortunately, these antigens are also the uh, the strongest inducers of T lymphocyte mediated rejection. Human leukocyte antigen tissue typing has been shown to reduce the frequency of rejection episodes, thus achieving a more successful outcome. Knowledge of the interaction of antigens with T cells in the rejection process is essential to understanding how immunosuppressive drugs work. For example, donor HLA human leukocyte antigen molecules are presented through antigen presenting cells or to resting T cells that have receptors for a specific antigen. This recognition process activates the T cells, which produce and secrete cytokines, for example interleukins, and express cell surface receptors, for example interleukin 2 or interleukin 2 receptors. The lymphocyte colony recognizes donor HLA antigen and differentiates and proliferates under the influence of interleukin 2, which has been called T cell growth factor. Cytotoxic T cells bind directly to donor cells and lyse them or destroy them. Other T cell subsets produce more cytokines, so for example, interleukin 4 and interferon gamma or IFN gamma, which leads to B lymphocyte involvement, antibody production, complement fixation, and macrophage infiltration. The result is destruction of graft tissue, which impairs the ability of the transplanted organ to function. Previous exposure of a recipient to other to other HLA human leukocyte antigens. So, for example, from blood transfusions, previous transplant or pregnancy, increases the probability or likelihood of rejection. The risk can be quantified using serological investigations such as panel reactive antibody tests or panel reactive antibody tests in which in which the higher the percentage score and the greater the recipient's sensitivity. If the PRA or panel reactive antibody score is more than 85%, then the potential recipient is considered to be highly sensitized and might require additional or stronger immunosuppressants or immunosuppression. Knowing the true structural variability of HLA system allows scientists to recognize and characterize allows scientists a laboratory uh, laboratory specialists to to recognize and characterize the true complexity of the immunological responses following transplantation. So live organ donation, live organ donation in literature has remained one of the gold sort of standard in around transplantation, whereby a live donor, traditionally a family member of a recipient, for example, consents to donate. However, a relative may not have the appropriate immunology owing to recipient HLA sensitization. A pathway that can then be considered, for example, or has been considered in literature and evidenced and evidence and evidence is a procedure which is referred to as plasmapheresis or a plasma exchange. So antibody removal by plasma exchange is or has become had become popular and allows sort of transplantation of very highly sensitized prospective transplant recipients. The success of these of the success of a plasmapheresis depends on being able to monitor antibody removal and identify the point at which a safe level has been matched, as well as monitoring for HLA antibody after the transplant to guide treatment. So in a plasma in plasmapheresis or plasma exchange, a protocol typically includes a process of plasmapheresis, whereby a recipient would undergo a process in which filtration of blood takes place to deplete it of donor-specific anti-HLA antibodies. Another step in this procedural protocol may be implementation of low-dose anti-rejection treatment. The this this plasmapheresis has been available in most had been available in most UK UK sort of validated centers who validated centers, and it is and has been a pathway for live related donors primarily who who come forward and want to donate or seek sought to donate an organ to recipients, uh, um, uh, uh, and even when where there have been cases in literature, for example, for example the cross match the cross match the cross match between donor and recipient, for example, are not for example for example it, for, are not um, are not serologically sorry are not, where serologically, for example, in context of the initial parts of cross matching and ABO blood grouping are 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 are, are viable. However, however, as however, at the same time, the tissue tissue cross matching, tissue typing cross matching, in context of additional identifying, for example, additional antibodies, for example, and antibodies and antigens as part of a PRA, panel reactive antibody investigation, um, may not may not and do not sort of allow 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 or allow sort of a cross match to historically be viable, owing to the disparities or the differences between tissue type tissue cross matching between donor and recipient. However, with plasmapheresis and the plasma exchange, the idea is again to desensitize the immunological process that would normally prompt or elicit a response, and so historically in literature, and where in the evidence there's evidence to indicate that, for example, the in cross and where cross matching is concerned in live transplanted cases, is where as where owing to, for example, where live transplantation between donor recipient is viable, owing to ABO compatibility, but also aligned to aligned to, for example, where live donors have tend to be in historically between, for example, between where for example live donors are either sibling to sibling, parents to sibling, etc., etc. So and so desensitization in live donation, in live transplantation, um, uh, historically has been and through and through plasmapheresis has been viable owing to that that particular aspect. Now, at the same time, preparation for a transplantation is not without its complications. Desensitization protocols at the time have also may um, help overcome incompatibility in some aspects, in some aspects where incompatibility, hindrances or barriers in live in around live transplantation, and provide a substantial prognosis advantage for recipients who are offered this modality. But at the same time, altruistic donation has also altruistic donation has also been has also been important, has also been sort of important or evidenced in literature. And so altruistic donation is the giving of an organ from a living person to a stranger. And in literature, in literature, for example, in the United States, around 2% of annual living donations are altruistic or have been altruistic. In the United Kingdom, altruistic organ donation had become sort of high profile since around 2006, when the HTA, the Human Tissue Act, set out a legal framework for anonymous donors. And out of 3,800 living donations since then 52 around 52 had been altruistic, although now in sort of in sort of 4 years sorry around 6 or 7 years following this particular publication in 2016, the number of altruistic donors may well have increased may well have increased. And at the same time, though, decreased or cadaveric donors are those who have declared who are declared brainstem dead, and whose organs are kept viable by ventilators or other mechanical mechanisms until they are removed for transplantation. So apart from brainstem dead donors who have formed the majority of deceased donors for the past 2 decades, there is an increasing use of donation after cardiac death, or DCD, formerly non heart beating donors, to increase the potential pool of donors as the demand for transplants continues to increase. So in around the sort of specifics, some specifics around transplantation grouping. So until sort of more recently, the sort of utilized uh, uh, most utilized sort of investigation utilized investigation or laboratory investigation relied on the ability of antibodies to sort of fix complement and cause cell death. And complement dependent cytotoxicity, or CDC, is a laboratory sort of practice that can be used to cross-match recipient serum against donor leukocytes. So, for example, white cells and T cells from blood. And if a serum sample is tested against a panel of white cells from donors with a range of different HLA types, it is possible to identify the specificity of of antibodies from reaction patterns with cells carrying different HLA types. This has always been an issue because some tissue types tend to occur in specific combinations of HLA antigens, giving rise to a range of random interpretations and to increase the donor pool donation after circulatory death. After donation after circulatory death, or DCD, in an alternative, which is as an alternative to donation only after brainstem death. The ABO blood group system, or the ABO grouping, is clinically or hematologically the most important or significant red cell antigen system. The antigens are expressed early in erythroid ontogenesis, but are also present on the endothelium of the kidney and the biliary tract. About 30 to 50% of allogenic hemopoietic cell transplants, or HCTs, are ABO mismatched. Major HBO mismatch can result in immediate hemolysis of red cells in the graft, or pure red cell aplasia. The former is usually prevented by removal of red cells and removal of host isohemagglutins, and various immunosuppression regimens are used, or ISTs are used, to preempt both immediate and late complications. The impact of ABO mismatch on hemopoietic cell transplants uh, 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 on hemopoietic cell transplants um, hemopoietic cell transplants uh, causes causes can cause can cause uh, can cause uh, issues in part of the cross matching. So again, about 30 to 50% of allogenic hemopoietic cell transplants, or HCTs, are ABO mismatched. Major ABO mismatch can result in immediate hemolysis of red cells in the graft, or pure red cell aplasia, and the former is usually prevented by removal of red cells, a removal of host isohemagglutins, and various immunosuppression IST regimens, and are used to preempt both immediate and late complications. The impact of ABO mismatch on HCT outcomes, such as graft versus host disease, survival, and relapse, is controversial and has been controversial. Minor ABO mismatch probably increases the risk of acute graft versus host disease, but effects on overall survival are less certain, and are at most minimal. Risk estimates of ABO mismatch are usually derived from registry data, which span years of transplantation activity, with contributing effects on many other risk factors. In contrast to a relatively weak effect on HCT outcomes, the ABO system is a major determinant of outcome in solid organ transplantation, in particularly in around renal and cardiac transplants. ABO mismatch has usually been avoided in transplantation of these organs, although organ shortage has led to an increase in ABO incompatible transplants. So strategies to reduce rejection risk have been devised, comprising of treatment such as monoclonal antibodies, rituximab and alemtuzumab, and plasma exchange or selective immunoabsorption. The passenger lymphocyte syndrome, an early manifestation of minor ABO mismatch, is common in solid organ transplant, but occurs occasionally in HCT. Comprehensively defining a patient or recipient's HLA antibody profile enables recognized antigens to be designated as unacceptable for transplantation, in that the presence on a donor a donor organ would result in antibody mediated hyperacute rejection. So, as a safeguard against relevant HLA antibodies being overlooked on serum screening, the cross-match test between donor cells and recipient serum is performed immediately before transplantation. A cross-match negative result is required for a transplant to proceed. Living donor transplantation, or LDT, is now an expedient response to the donor shortage. It offers a better long-term allograft survival than deceased donor transplantation or cadaveric transplantation, and also offers a choice about when transplantation is performed, in particular allowing transplantation to take place before other forms of treatments may be or are required. In addition, for many people with HLA antibody, living donor transplantation, or LDT across an antibody barrier may be the only realistic chance of a transplant. So, in around a little bit about antibody unacceptability. So, in renal transplantation, immunogenicity and alloantigen load can be reduced through minimizing HLA mismatching of the donor and recipient. This is effective in reducing the number of severity of acute rejection episodes, and is also transplanted into improved long-term allograft survival or prognoses. Strategies that have been developed to improve cross-match accuracy for the population include utilizing a core laboratory specifying thresholds for assigning unacceptable HLA types, and allowing sites to enter two sets of antigens, one representing the site's criteria for automatic refusal, and another that includes antibodies that are not an automatic contradiction, but could be a problem, particularly when there are several weak donor specific antibodies. So, a little bit around the importance of uh, a little bit now in the importance around scientists in community in around this as part of this context. So, in order to highlight the broader issues surrounding transplantation, scientists should get involved in, for example, local media initiatives such as local radio stations contributing to newsletters and giving talks in communities. And there is broader evidence to suggest that more health promotion in community can support the understanding of some of the complexities relating to health and disease. And it would be good. It can be good, to see for example, laboratory specialists participate in for example in video interviews highlighting the importance of in around transplantation and relating issues for different for different communities. It is also important to to see that the varying health professionals across the multidisciplinary team, or MDT, share evidence-based practices, as knowledge sharing can lead to improved patient-reported outcome measures, and improved shared decision making. That draws this audio podcast to a close. This has been an audio podcast as part of the Proxi Beat. This audio podcast as part of a Catharsis Scrutiny. This audio podcast as part of the Robotics Interval, and this audio podcast as part of a Storm Robotics production.